Hey, fellow medical news enthusiasts, I'm Drew Hansen with ep2, and I'm here to review some of the news stories from yesterday that you might have missed. Alright, first up we have healthnews.com. They're reporting on 3 new weight loss drugs that are on the horizon. Specifically, they're talking about the FDA is beginning to review this week on several new weight loss drugs, bringing with it another round of hope for overweight and obese Americans. Trying to find an effective drug therapy for obesity has been more difficult than finding a needle in a haystack, but hopes remain high that a magic pill will pass all the required tests and make its way to the market. Now there are 3 such chances with 3 potential new drugs. The new drugs are Quenexa, Contrave, and Lorcaserin. All have been tracking pretty positive in trial tests, but as with all drugs, the last hurdle to jump is with the FDA. Alright, and staying in the same vein of the FDA, CNN Health, specifically the Paging Dr. Gupta blog, is reporting on the fate of Avandia. They're saying specifically a Food and Drug Administration hearing on the safety of Avandia gets underway Tuesday morning. After 2 days of chewing over evidence, an expert panel will vote, among other things, on whether to yank the popular diabetes drug off the market. Avandia has been under the microscope for a possible link to heart problems, although the drug's developer and manufacturer GlaxoSmithKline, asserts that clinical studies show the drug is safe. A major topic of the hearing will be one of those trials, known as the RECORD study, which was criticized in the blistering analysis published on the FDA website on Friday. Alright, and up next we have a sort of disturbing story from NewYorkTimes.com. It's reporting that desperate addicts inject others' blood. What they're talking about here is that heroin users in a few African cities have begun injecting other addicts' blood, researchers say, in an effort to share the high or stave off the pangs of withdrawal. Up next, we have some good news coming out of Africa. The Associated Press is reporting that the number of young people infected with HIV in Africa is falling in 16 of the 25 countries hardest hit by the virus, according to a new report by a UN agency. The number of young people infected with HIV dropped by at least 25% in a dozen countries. The UN AIDS report said in Kenya, the infection rate among people aged 15 to 24 fell from about 14% in 2000 to 5.4% in urban areas. Now, they attribute the drop in HIV rates with a change in sexual behavior, like having fewer sexual partners or increased condom use. But the agency could not say the drop was because of recent UN policies, which have mainly focused on buying AIDS drugs rather than preventing infections. Alright, up next, I don't know if any of you remember that little H1N1 pandemic scare that we had about a year ago. Well, medicalnewstoday.com is reporting that public health recommendations during the H1N1 pandemic were adopted by less than 5% of the population. Approximately 1 out of every 4 people observed in a public setting failed to cover their mouth when they coughed or sneezed, according to research presented at the International Conference on Emerging Infectious Diseases. Even more concerning, less than 5% of people cover their mouth using methods recommended by public health officials. Alright, last up, from American Medical News, or AMEDnews.com, they're reporting that prescription drug overdose cases have skyrocketed in emergency departments. Fatal poisonings from opioid overdoses tripled to nearly 14,000 deaths from 1999 to 2006. The Centers for Disease Control and Prevention reported in September 2009. The tally of near-death incidents involving opioids is far higher and growing rapidly, as revealed in the CDC's June 18th Morbidity and Mortality Weekly Report. Emergency department visits related to misuse of prescription or over-the-counter drugs doubled from 500,000 to 2004 to 1 million in 2008, said the report, based on estimates from the Substance Abuse and Mental Health Services Administration's Drug Abuse Warning Network, also known as DAWN. Now, DAWN generated the estimates by reviewing data and medical charts submitted by 231 U.S. emergency departments. They further go on to report that an FDA proposal could require opioid manufacturers to do more to educate physicians and patients on the potential dangers of their products. Alright, that'll do it for today. Thanks for tuning in. And as always, if you have any comments or suggestions, please leave them below. Or you can find me on Twitter at MDITV. Alright, have a great day and check back tomorrow for another set of reviews.